So if you picture a Friesian horse, you probably see, well, something straight out of a medieval fairy tale.
Oh, absolutely. They have that look.
Right. You're imagining that striking jet black coat, the majestic flowing feathered hair around the lower legs, and that incredibly distinctive, hyper-flexing, high-stepping gait.
Yeah, the way they move is just iconic.
It really is. It's a creature that looks less like a working animal and more like, I don't know, a carefully crafted piece of kinetic art. But when we pull together today's stack of sources, and we're talking Ghent University biomechanical studies, Utrecht University training data, even clinical case reports out of Brazil, a much more complex reality emerged right beneath that beautiful aesthetic.
It is a stunning breed, and I mean, the dedication of the community surrounding them is just intense. We actually saw a reflection of that dedication recently.
Oh, the new approvals, right?
Yeah, exactly.
Yeah.
In January 2025, two new stallions, Gerb 548 and Sepk 549, they successfully passed their driving exams in the U.S., which earned their approval from the Royal Frisian Stud Book, or the KFPS.
Which is a monumental triumph for North American breeders. I mean, the testing to get that approval evaluates everything from saddle performance to foundational movement. And it had been, what, a full 10 years since an approved stallion was welcomed on U.S. soil?
Yep, a whole decade.
Yeah.
It's a massive win for the community.
It really is. But our mission for this deep dive is to look at the hidden cost of maintaining that iconic standard. Because I was looking through a study from a Dutch university veterinary clinic in our sources, and one statistic just immediately jumped out at me.
The population percentage versus the caseload.
Yes. Friesian horses made up about 7% of the local horse population in that area. But when researchers looked at the clinic's actual caseload, Friesians accounted for a vastly disproportionate percentage of the patients.
Yeah, and look, when any single breed shows up in a veterinary hospital at rates that completely outstrip their baseline population, it points toward a systemic vulnerability. The clinic isn't just seeing them for, standard pasture accidents or common colics.
Right.
They're seeing them for a highly specific, very strange cluster of issues.
And that's exactly what we are going to explore today. We're diving into the surprising genetic puzzle behind the Friesian. We want to see how the very traits that make their Baroque aesthetic so unique might be inextricably linked to a cascade of unusual health crises. And of course, we'll look at the hard science the breeding community is deploying to actually manage it.
It's a fascinating intersection of aesthetics and biology.
It really is. So let's start with the physical traits. The vertical neck, the high-stepping movement. The sources suggest the selection for this aesthetic is the root cause of their medical vulnerabilities. But the conditions we are talking about seem completely unrelated on the surface.
They definitely do.
For instance, in the general horse population, the incidence rate of a mare retaining her placenta after giving birth is roughly 2 to 10%. In Friesian mares, that number is a staggering 54%.
Which is just a wild statistical jump. To understand why that number is so high, you really have to look at what physically happens during foaling.
Okay, walk me through it.
So the equine placenta attaches to the uterine wall via these microscopic structures called microcotyledons.
Microcotyledons, got it.
Right. And for the placenta to expel properly, the connective tissue linking those structures has to basically break down and release. When it fails to degrade in over half the Friesian population, it points to a fundamental anomaly in how their connective tissue is constructed and how it behaves under physiological stress.
See, I'm struggling to connect a foaling issue with the other stats in the research, though. I mean, the sources also highlight insect bite hypersensitivity. Shetland ponies have an incidence rate of around 8%. In Friesians, it's 18%.
Yeah.
And then there's dwarfism. The affected foals have a normal-sized head, but their limbs and ribs are 25% shorter, and their body weight is about 50% lower than a healthy foal. What bridge possibly connects a hyperflexible dancing gait to a skin reaction and shortened ribs?
Well, the bridge connecting all of them is the physical scaffolding of the body. Veterinary researchers overwhelmingly suspect a systemic collagen-linked abnormality.
Wait, collagen? Like what's in our skin and joints?
Exactly.
Yeah.
Collagen dictates the structural integrity of almost everything in the body. It's in the dermal matrix of the skin, which affects barrier function and immune signaling, which could potentially explain that hypersensitivity to insect bites.
Oh, wow.
It is also crucial for cartilage development in the long bones, which ties directly into the dwarfism.
Yeah.
And, of course, it's the primary building block of tendons and ligaments.
So by selectively breeding for that high-stepping, hyperelastic movement, breeders were inadvertently tuning the genetic code for tendon and ligament laxity.
That's the running theory, yeah.
Let me try an analogy here. It feels like tuning a guitar string way too tightly to achieve one specific beautiful pitch. Eventually, the tension doesn't just affect the string itself. It pulls on the neck, it warps the bridge, and the integrity of the entire instrument is compromised because the base material is just under abnormal stress.
That is a brilliant way to put it. The physical manifestation of that laxity is most obvious in the Friesian's fetlock, which is essentially the ankle joint.
Okay.
Because the ligaments are looser, the joint hyperextends, so the horse's foot ends up hitting the ground in a much more upright position.
Which changes the whole biomechanics of the leg.
Exactly. And interestingly, that upright hoof geometry actually shields them from navicular disease, which is a degenerative hoof condition that's super common in other breeds. It shields them because the mechanical load just bypasses the navicular bone entirely.
Oh, so it's a weird silver lining.
Right. But that same soft tissue laxity leaves the suspensory ligaments wildly vulnerable to injury. They're just not supported the way they should be.
But if we're looking at a systemic weakness in the body's physical scaffolding, the ultimate stress test for that material isn't a joint, is it? It's the cardiovascular system.
Oh, absolutely.
Because the aorta handles the intense, constant pressure of blood being ejected directly from the left ventricle, so it relies massively on collagen and elastin to expand and snap back without tearing. And the sources show aortic rupture is far more common in Friesians than in other breeds.
Think of the aorta as essentially a high-pressure hose. If the collagen fibers weaving that hose together are inherently faulty, you expect catastrophic failure.
Which is terrifying.
It is. A 2015 study from Ghent University actually set out to map exactly how and why this was happening in Friesians. They took samples of the thoracic aorta from Friesians who had died from ruptures, healthy Friesians, and warm-blood horses, and put them through uniaxial tensile testing.
So they essentially locked these tissue samples into a specialized vice grip, slowly pulling them apart the way, like, an engineer would test the breaking point of a climbing rope.
That's exactly it.
Measuring the exact gram of force required to snap the tissue.
Yes. They stretched the tissue from a zero-stress state until physical rupture, tracking both the force and the displacement. They really wanted to measure the fundamental stiffness and strength of the artery wall.
And what did they find as a baseline?
The biomechanical baseline they established is that the distal aorta, the section further away from the heart, is naturally stiffer and contains up to 31% more collagen than the proximal section closer to the heart.
Wait, hold on. If the running theory is a breed-wide systemic collagen defect, shouldn't the entire Friesian aorta be structurally weaker and more elastic than a warm blood's?
You would certainly think so.
Because in humans, conditions like Marfan syndrome cause the connective tissue to be globally weakened, and the entire aorta dilates and balloons out. Shouldn't we see the exact same global decay here?
And that is where the data from Ghent University completely upends that assumption.
Really?
Yeah. The researchers found no significant biomechanical or biochemical differences between the aortas of the Friesians and the warm bloods.
Wait, none?
None. The tensile strength, the elastin levels, the collagen percentages, they were all essentially identical. And even more revealing, histological examinations under a microscope showed no Marfan-like cystic medial necrosis. The walls of the artery weren't decaying or ballooning globally at all.
So the building materials of the artery are completely normal. Why are they rupturing then?
Because the rupture doesn't happen just anywhere along the vessel. In Friesians, it almost exclusively occurs at one highly specific, localized spot near an embryological remnant called the ligamentum arteriosum.
The ligamentum arteriosum.
Right. This structure connects the aorta to the pulmonary artery. The fact that the vessel bursts at this exact junction while the rest of the aorta remains perfectly strong proves this isn't a generalized weakening.
It's a localized architectural flaw.
Exactly. A highly localized hereditary defect. A specific flaw at a high-tension anchor point, rather than bad material throughout the whole hose.
Wow. A localized architectural flaw is almost more terrifying, especially since you can't easily screen for a microscopic weakness at one single junction before it gives way.
No, it's virtually impossible to catch before it happens.
And the mechanical failures caused by the breed's genetic bottleneck don't stop at the cardiovascular system. When we look at how the Friesian body handles gravity and physical volume, we see bizarre anomalies in the digestive and lymphatic systems, too. The statistics around their esophagus are particularly jarring.
You are referring to megaesophagus?
Yes.
It's an awful condition where the muscular tube carrying food from the mouth to the stomach becomes massively dilated and just loses its motility.
So it can't push the food down.
Exactly. The food simply sits there. The horse can't move the bolus down into the stomach, which leads to chronic choking. But the immediate danger is that the backed up food and saliva get inhaled into the lungs, causing a fatal aspiration pneumonia.
And the incidence rate is what stopped me in my tracks. Friesians have a 70 times higher incidence of megaesophagus compared to other breeds.
70 times.
A 70-fold increase isn't a coincidence. That is a hardwired genetic predisposition.
It absolutely is.
Yeah.
And when veterinary pathologists perform necropsies on these cases, they find massive muscular hypertrophy, which is a thickening and overgrowth of the smooth muscle, specifically in the caudal or lower portion of the esophagus.
What triggers that specific overgrowth?
Well, this specific morphology caught the attention of researchers because it mirrors a rare human genetic condition called Alport syndrome. In humans, Alport syndrome is driven by a mutation in the gene encoding type 4 collagen.
There's that collagen connection again.
Yep, that specific collagen mutation triggers the exact same kind of smooth muscle hypertrophy we see in these horses.
It really all routes back to the physical coding of the connective tissue, which brings us to the lymphatic system, specifically in their legs. Now, if you've ever owned a horse, you know how incredibly fragile their lower limbs can be under the best of circumstances.
Oh, for sure.
But the Friesian signature feature, those heavy, flowing, feathered legs, is the site of a devastating condition called chronic progressive lymphedema, or CPL.
Yeah, CPL is incredibly tough. The lymphatic system relies on a network of dermal vessels to constantly drain excess fluid and cellular waste out of the tissues and pump it back toward the heart.
Well, right, fighting gravity.
Exactly. But in CPL, that drainage mechanism fails completely in the lower limbs. We have a detailed 2022 case report from Brazil looking at a 15-year-old Friesian stallion that illustrates the sheer severity of this disease.
The clinical description of that stallion is just brutal. I mean, it wasn't just a little swelling. The horse had massive skin folds, severe fibrosis where the tissue had basically turned to thick scarring, and hard nodular lesions encompassing his lower leg.
It's agonizing for them.
And because the skin barrier was stretched and compromised by all that trapped fluid, he became a magnet for secondary infections. The report detailed bacterial invasions of Streptococcus and Proteus, which was then compounded by an infestation of Coreoptes bovis mites.
And the physiological failure here lies right in those dermal lymphatic vessels. They lack the proper elastin quality to contract and push the lymph fluid up against gravity.
So it just stays there.
Right. The fluid pools, the proteins in the lymph, trigger a massive inflammatory response, and that inflammation creates the dense fibrous scar tissue you mentioned.
I was trying to picture the fluid dynamics of this while reading the sources. It's essentially a massive traffic jam in the horse's leg. The fluid arrives, but the structural roads out are just blocked.
That's a great way to visualize it.
And the tragic irony is that their iconic feathered legs act as a heavy curtain. The hair completely hides the early stages of swelling and the development of those nodular lesions. An owner might not realize the extent of the tissue damage until the disease is incredibly advanced.
And that curtain effect is a massive hurdle for veterinarians. Owners are understandably reluctant to shave off the feathers that literally define the breed's look, so early intervention is incredibly rare.
Which just allows the traffic jam to get worse.
Exactly. And because these are deep structural genetic flaws, whether we're talking about the smooth muscle in the esophagus or the elastin in the lymphatic vessels, there are no simple surgical or pharmacological cures. The entirety of veterinary care relies on intense daily management.
Like, for a megaesophagus patient, management means altering the very physics of eating. You have to feed them highly softened, wet mashes, and you place the feed tub at chest height so gravity can literally pull the food down the dilated esophagus.
Yeah, and with CPL, the management is even more labor-intensive. It requires clipping those beautiful feathers, maintaining extreme hygiene to stave off the streptococcus, applying topical treatments for the mites, and managing the bacterial load with antibiotics.
That sounds exhausting for the owner and the horse.
It is, but the physiological key to managing CPL is actually movement. Since the lymphatic vessels can't contract on their own, the horse relies on the physical contraction of its leg muscles during a walk to act as a mechanical pump, basically forcing the pool fluid out of the lower limb.
But wait, the disease creates an impossible catch-22, doesn't it?
Yes, it does.
The horse desperately needs to walk to pump the fluid away, but the massive skin folds, the painful ulcers, and the secondary infections cause such profound lameness that the horse refuses to move.
Exactly. By the time the disease reaches grade 4, the sheer mechanical restriction of the scarred, fibrotic tissue makes normal articulation of the joints absolutely agonizing. The pump is broken, and the horse is in extreme pain.
It's a very sobering reality, but that leads us directly into the science of salvation. Because the breeding community knows they cannot instantly rewrite the DNA of the global Friesian population to just fix the type 4 collagen or strengthen the ligamentum arteriosum.
No, you can't just flip a genetic switch.
Right. But they are taking aggressive, scientifically backed steps to optimize the horses they have today and protect the generations coming tomorrow.
They really are. They're attacking the problem through two primary avenues: long-term pedigree analysis and immediate physiological management.
Let's talk about the genetics first.
Sure. On the genetic front, the Friesian Horse Association of North America, FARA, announced a major series of collaboration meetings in May 2026 with the KFPS in the Netherlands. The goal is to rigorously analyze kinship issues and track exactly how high inbreeding coefficients correlate with the clinical presentation of these exact soft tissue and autoimmune problems.
So they are actively mapping the family trees, looking for the specific intersections where this faulty code gets passed down so they can strategically widen the genetic bottleneck.
Exactly. But they also have to change how the horses standing in the barns right now are conditioned. And the Utrecht University study on the KFPS 70-day test is just a masterclass in using hard data to change tradition.
A 70-day test. That's the grueling evaluation period young stallions undergo to prove their physical and temperamental worth for breeding, right?
Yes, it is notoriously tough. But the researchers from Utrecht looked closely at the physiological data and realized the young stallions were actually declining in fitness over the course of the old training program.
Declining. Why?
They were in a state of chronic overtraining. The traditional schedule had them working 4.4 days a week, frequently stacking intense training sessions back to back without any real recovery.
And the KFPS didn't ignore the data, which is amazing. They completely overhauled the program based on it. The new training protocol dropped the workload down to 3.8 days a week. They significantly reduced the volume of cantering. And most importantly, they strictly mandated days of rest or very low-intensity movement immediately following any hard workout.
And the physiological response to that adjustment was profound. By bringing the average training session down to just 24 minutes and injecting that mandatory recovery time, the young stallions exhibited higher overall fitness levels.
That's incredible.
It is. And the researchers didn't just guess at this. They measured it objectively by tracking the horse's heart rate recovery times and the concentration of plasma lactate in their blood after exercise.
So by giving the horse's body the time to actually repair microtears, especially a body that is genetically predisposed to connective tissue strain, they allowed the muscles and ligaments to adapt and strengthen. They essentially created a superior athlete by doing less.
It perfectly highlights a vital principle in exercise physiology.
Mm-hmm.
Fitness is built during the recovery phase, not the exertion phase.
Right.
The transparency of the KFPS registry here is highly commendable. I mean, they openly acknowledged a flaw in their testing parameters and utilized objective training physiology to serve their ultimate mandate, which is the long-term health and welfare of the breed.
We've covered some incredible ground today. We started with the celebration of Gerb and Sepke passing their rigorous exams, proving the Friesians' capability as a majestic athletic partner. But we also pulled back the curtain on the hidden genetic vulnerabilities.
Yeah, the localized anatomical weakness triggering aortic ruptures.
Exactly. The 70-fold increase in megaesophagus tied to collagen mutations, and of course the heavy physical toll of chronic progressive lymphedema.
Yet we also saw a breeding community that refuses to look away. They're deploying advanced pedigree mapping and objective physiological data to systematically manage the flaws created by their own historical selection processes.
It definitely forces you to view that fairy tale aesthetic with a much deeper appreciation for the fragile biology holding it all together, which leaves you with a lingering question to ponder.
What's that?
As veterinary science advances, we are seeing the rise of targeted gene therapies. I mean, if we are moving toward a future where we use CRISPR technology to edit human embryos for debilitating diseases, how long before that technology enters the equine world?
That's a heavy thought.
Will breeders use genetic engineering simply to repair the fatal flaw at the ligamentum arteriosum? Or will the temptation be too great and we see them using CRISPR to artificially engineer that perfect hyperflexing dancing gait right in a lab?
The line between therapeutic intervention and genetic enhancement is only going to get thinner.
It really is. Thank you for joining us on this deep dive. The next time you see a Friesian trotting across a field, you'll understand the complex biomechanical reality beneath that beautiful motion. Catch you next time.